Hello everyone, welcome to the Smart RN channel. My name is Henry. Today we continue with our series on the cardiovascular system. And in this video, we are going to look at the cardiac conduction system. So let's get started. The heart pumps blood throughout the body, and it does this because of the cardiac specialized cells and the cardiac conduction system. The cardiac cells have got three major characteristics. We have automaticity, excitability, and conductivity. So cardiac cells have the ability to generate or to initiate electrical impulses independently and rhythmically. They can generate electrical impulses on their own and in a particular rhythm. So when they do this, we say that cardiac cells are automatic. Now, when cardiac cells generate electrical impulses, we refer to them as pacemaker cells. Now, we can have pacemaker cells in either of three locations within the heart. One, we have the SA node or the sinoatrial node. This is the primary pacemaker of the heart, and it generates impulses at the rate of 60 to 100 beats per minute. Then we also have the atrioventricular node or the AV node. The AV node generates electrical impulses at the rate of 40 to 60 beats per minute. And in other cases, ventricular cells can also act as pacemaker cells. And when they do that, they generate impulses at the rate of 20 to 40 beats per minute. Now, when we come to a situation whereby ventricular cells are the ones acting as pacemaker cells, then that's not a very good situation for this particular patient, because these ventricular cells can only provide beats at a rate of 20 to 40 beats per minute, which are not sufficient, or which may not be sufficient to pump blood to the rest of the body. Now, so the SA node is found in that area. And when the SA node generates impulses, it does that at a rate of 60 to 100 beats per minute. And this is the one that we normally have in a normal heart. So an average of between 60 to 100 beats, we say that's normal. Now, the AV node can also generate electrical impulses. In case the SA node is not firing, then the AV node can fire, and it can only do that at a rate of 40 to 60 beats per minute. If the AV node fails to fire, if both of these are not firing, then the ventricles have the ability to act as pacemaker cells, and they can only do that at a rate of 20 to 40 beats per minute. And we said that's not a very good situation for that particular patient. So apart from automaticity, cardiac cells have a characteristic of excitability. They have the ability to respond to a stimulus. Cardiac cells can respond to that electrical impulses which are generated by pacemaker cells. Then cardiac cells can also conduct electrical impulses throughout the heart. And that's why these electrical impulses are able to travel from the pacemaker cells to the rest of the heart, so that the heart can be able to pump blood throughout the system. So we say the cardiac cells have a characteristic of conductivity. So those three characteristics, automaticity, excitability, and conductivity, enable the heart to perform its function of pumping blood throughout the body. So let's look at a normal pathway of an electrical impulse within the heart. So the SA node is the primary pacemaker of the heart. When the electrical impulse travels from the SA node, it goes to the AV node, and it travels from the SA node to the AV node through the internodal pathways. So we have internodal pathways. It travels in that direction, travels in this direction, and then comes to the AV node. So the electrical impulses travel through the atria via the internodal pathways. So at the AV node, the electrical impulses are delayed, And this delay is to enable the ventricles to be able to fill up completely with blood before they can fire. So there is a slight delay of the electrical impulses at the AV node. From the AV node, they travel to the bundle of His. Then from the bundle of His, the electrical impulses travels to the left and right bundle branches before coming to the Purkinje fibers. And at that point, the ventricles are able to contract and pump blood. So the electrical impulse comes the SA. Remember, in a normal working heart, we expect the SA node to be the primary pacemaker, the one firing. So from the SA node, the impulses travel through the atria via the internodal pathways. They arrive at the AV node. There is a slight delay of the impulse at this node just to enable the ventricles to fill up with blood. From the AV node, they come to the bundle of His. From the bundle of His, the electrical impulses travel through the right bundle branches and the left bundle branches. Then they spread to the Purkinje fibers, and at that time, the heart pumps or contracts and pumps blood to the rest of the body. Now, let's look at an electrocardiogram. So an electrocardiogram is the one in short, we refer to it as an EKG or an ECG. An electrocardiogram is a diagrammatic representation of the heart's electrical activity. The heart's electrical activity can be represented by an electrocardiogram. Now, this electrocardiogram is a series of waves that denote the position of the electrical impulse at different places within the heart. So we have the P waves, the QRS wave, and the T wave. Now, the P wave, or before we look at that, there are two terms I want us to look at. We have depolarization and repolarization. These two terms just refer to the mode, or they refer to the mode of the heart at different times when this electric impulse is actually traveling through that heart. So depolarization is contraction mode, is when the heart contracts. So when we say the heart depolarizes, we say the heart contracts. Repolarization, on the other hand, refers to rest or relaxation of the heart. Remember, repolarization, then relaxation or rest. So RERE. So the best way to differentiate them to look at this: repolarization is rest, depolarization is contraction. So in depolarized mode, the heart is contracted, and in repolarization mode, the heart is relaxing and filling up with blood. So the P wave represents the atria depolarization, when the atria contracts to pump blood. The QRS wave represents ventricular depolarization, when the ventricle contracts to pump blood. And the T wave represents ventricular relaxation or repolarization. So when the ventricles contract, it is the QRS wave. When the ventricles relax, it is the T wave. You might ask, what about the P wave? When the P wave relaxes, what shows the P wave relaxation? Now, remember, when the ventricles contract, the atria relaxes. So the wave for atria relaxation is buried in the QRS complex. It is invisible. We cannot be able to see it. Why? Because the time the ventricles contract, that's when the atria relaxes. But when the ventricles relax, then the atria contracts. So this represents ventricular contraction, and this represents ventricular relaxation. Now we also have the PR interval. The PR interval is from the beginning of the P wave to the beginning of the QR or the QRS wave. It represents the travel of the electrical impulse through the atrium and the AV node. So when the impulse is traveling from the atria through the AV node, that is the PR interval. Now we have the PR segment from the end of the P wave to the beginning of the QRS wave. The PR interval represents that delay at the AV node. Remember we said that when the electrical impulse arrives at the AV node, there is a slight delay in transmitting it. Why? So that the ventricles can be able to fill up with blood. So that delay of the impulse at the AV node is represented by this particular PR interval. Then we have the QT interval. The QT interval represents ventricular depolarization and repolarization. So when the ventricles depolarize and repolarize, we refer to, or is represented by the QT interval. So that's when the ventricles contract and when they relax. Now the ST interval, the ST segment, it represents that duration between ventricular contraction and the beginning of ventricular relaxation. So when we are interpreting an electrocardiogram, we look at this particular P waves in different ways. Now remember, for every Q wave or for every QRS wave, there must be a P wave when we are looking at this particular electro system. But there are cases whereby we might have a P wave without a QRS wave. Those are conditions. So we are going to look at all those particular cardiovascular conditions. So remember, in normal circumstances, there must be a P wave, then a QRS wave. But is that always the case? No. We might have two successive P waves, then we have a QRS wave. So we might have a P wave without a QRS wave. So remember, that's not normal. In normal circumstances, we are supposed to have a P wave and a QRS wave. So when we are looking at an electrocardiogram, when you are interpreting an electrocardiogram, you look at things like, are there P waves? Are there QRS waves? Are these P waves regular? In other words, is the distance between the P waves regular or is it irregular? Are there QRS waves for every P wave? Are these QRS regular or are they irregular? Those are the kind of things that we look at. What is the width of the QRS wave? What is the width of the P wave? What is the width of the PR segment? So we are going to look at, those are the things you look at when you are actually performing interpretation of an EKG. So that brings us to the end of this video on the cardiac conduction system. As always, drop a comment, like this video, share this video, and if you have not subscribed to this channel, please subscribe to this particular channel. From me here, it is a goodbye.